Welcome to This Week in Health IT events, where we amplify great ideas with interviews from the floor. My name is Bill Russell, healthcare CIO coach and creator of This Week in Health IT, a set of podcasts and videos dedicated to developing the next generation of health leaders. We want to thank our founding channel sponsors who make this content possible, Health Lyrics and VMware. If you want to be a part of our mission to develop health leaders, go to thisweekhealth.com/sponsor for more information. This episode is sponsored by Health Lyrics. When I became a CIO, I was really overwhelmed at first, and one of the first things I did was to sign a CIO coach to walk with me through the journey. This was someone who had wisdom that can only be gained through years of experience. It was invaluable to my success in the role, and I now coach CIOs through Health Lyrics. If you want to learn more, visit healthlyrics.com or drop me a note at bill@thisweekinhealthit.com. Over the next 3 weeks, we have a huge treat for you. I'm really excited about it. I just got back from the CHIME Fall Forum in Scottsdale, which was a great event, and we caught up with 12 active CIOs from various size health systems and asked them to take a look back at 2019 and a look forward at 2020. You're going to hear what they're excited to have accomplished last year and what they're looking forward to accomplish next year. I asked each of them the same 8 questions, and I think you're going to be fascinated to hear the similarities and the differences based on where they're at, geography, and other things. Each of these interviews is about 10 minutes long, so you can listen to them really quick, and some of you listen at 1.5 times speed, so it's going to go like that. We're going to publish one a day with a few Newsday episodes sprinkled in through the end of November, so check back every day for the next episode, and don't forget to look back to see if you missed any. Cletis Earle was extremely busy at the CHIME conference. He was up on stage. He was everywhere. And I really appreciate him taking the time to sit down right before he got up on stage with me. Cletis is the CIO for Kaleida Health in Buffalo, New York. Great conversation. Hope you enjoy. All right, here we are. Another interview from the CHIME Fall Forum. We're with Cletis Earle, chairman of the Foundation. Yeah. So you're double mic'd up this morning. Looking forward to that.
And you're about to go on in a few minutes.
Yeah. Going to go up on stage with Kaleida Health up in upstate New York.
In the Buffalo area.
Yeah.
Western New York.
Well, I'm looking forward to this. So we, what we're doing is look back, look forward on what's happened this year, what's going on next year. So first question, how have you seen the role of the CIO change over the last year in 2019?
It's interesting you asked the question because the role has significantly changed. We as CIOs, we've traditionally worried about implementing EMRs, ERPs, and various systems. But as organizations move from a fee-for-service to a value-based, our goal is to really actively become a more engaged consumer outside of the four walls of the institution. So I've seen a significant amount of uptick of really dealing with collaborative relationships. So much so that we're collaborating in our area. We're collaborating with multiple vectors, multiple industries. We have a significant amount of collaboration going on with banking and other industries just to really align our resources because we're all struggling. Believe it or not, in an area such as Western New York, there's not the talent pool that you can just really readily grab. So CIOs from myself and CIO from M&T Bank and a few others have worked together to put together efforts to pool our resources together. So it's that kind of collaborative, really out-the-box thinking to see how we're going to work, and that's where CIOs are evolving because I know these same challenges are occurring across not only the country but around the globe, trying to get those important resources to help us be successful.
It's interesting because I'm going to go through all the questions, but it's interesting on the finding great talent because you need great talent in order to succeed.
Absolutely.
And you have some markets. We talked to Darren Dworkin yesterday. And he's like, we have sub 1% employment within the health IT space because we just can't find and hire people.
Right.
Then you have other places that are maybe a little more rural or not as big as Southern California or LA. And the other problem exists, which is we're not producing enough talent maybe out of the colleges to with the right skill sets to do the roles. So it's interesting. It's same problem, different manifestations.
Absolutely.
What are some of the priorities that your health system is pursuing next year that your health IT organization is going to support?
One of the biggest priorities in New York State's pretty tough. It's a pretty tough market. I've seen it. I've moved from the bottom of the state all the way up to the very top. One of the biggest priorities is helping the organization become more efficient when it comes to revenue, quality. You think that these are standing traits, but as the EMRs go in and those systems go in, it's not just about putting in the new shiny object, but putting it in and making it as efficient to the business as possible, and that's kind of one of the tasks that we're looking at. So operational efficiency, quality efficiency, and really impacting how it impact the positive impact to revenue.
Yeah. So you're going to keep optimizing that platform.
Continue to optimize and partner with companies such as our EHRs to really look at how do we get the best bang out of the dollar, so that we can have the maximum return on investment for that particular solution. I mean, think about this. How many scenarios in the world you can spend, hundreds of millions of dollars up to $1 billion and not know exactly what the return on investment is going to be? I mean, I think we're probably in the only industry that does that, but it's just something that we have to start to change the narrative.
Yeah, absolutely. And yeah, leadership from the edge last night. The Arch Collaborative shared a lot of things around. That was a great session.
Yeah, it was.
So we're going to look forward to two initiatives. One initiative that you think is going to materially impact the patient experience, and one that's going to, for next year, materially impact the clinician experience.
Yeah. So for the patient side, again, I do believe that consumerism should be one of the highest focuses that we as an industry, being in on. Our organization, we've put in at our new children's hospital, we put in a great patient engagement solution, an infotainment system that very similar to the hotels. It allows us to not only just have our patients have access to television and movies, but it allows us to do just-in-time service and also service recovery. So not waiting for that patient to leave the hospital for us to see how we're doing and how we're able to do it, but allowing the patient to, in real time, be able to say, my room is too cold, or I didn't get the food that I wanted, or that engagement with that provider was not as optimal as it needs to be. And it allows us that then triggers alerts to our leadership team to allow action, so that when that patient leaves, we know that we've addressed the issues as best as possible. That's we did it at our children's hospital. We're rolling it out to the rest of the organization. And it's interesting, we've done something very similar where we have rounding tools with our nurses. We found where sometimes a round could occur, and then an hour later we'll get an alert that the patient was dissatisfied. And that's how real time we have to become, because that's very similar to how other industries operate. We really have to be more reactive to their needs, but in more of a more functional time frame.
Yeah, it's I mean, those are interesting, and you're going to continue to work on the clinician experience.
So in turn, that same solution works for the clinicians as well. So it's that, again, being able to get as much real-time data so that we can actually move. What we're doing, we put in adoption coaches throughout our organization to make sure that we have more at-the-elbow support for our providers, so that they're not necessarily, once it gets implemented, we don't see them again. We are looking at our data by using some of the tools, some of the analytics tools, and we're going out there and making sure that if we see that there are providers using the system that are outside of the norm, we target those providers to get them back into the pool. And we've been able to save them a significant amount of time so that they can technically be with the patients and have more time and help reduce physician burnout.
What are you most proud of your team for accomplishing this year, IT success for 2019?
A lot. Everything that they do. I'm proud of the efforts that we've helped in our community to help build homes for Habitat for Humanity. I'm proud for the fact that we've been able to come together as a complicated health system, and coming together as a team. I think, what I'm most proud of is the change of culture. That it takes a lot. We're not far, we're not there, but we're on our path. So I think that it takes a lot for an organization to go down one direction and then pivot within a very short time to go in another. And that's great because it's now in line to the organization's strategic objectives.
Yeah, no, that's fantastic. Any missed opportunities for 2019? Things you wish you had worked on more and just didn't get around to?
No, no, I don't think so. I think, in our world, we can work on a billion things and still feel that you missed something. As long as our organization, our IT strat plan is lined up with our organization strat plan, and we continue to focus on that effort, I don't think that I don't have any regret. I always think that there's always opportunity to check around innovation to work on other initiatives, but nothing one singular thing I can think of.
That's great. Where's an area you'd like to see more innovation? There's so many innovation conferences now and those kind of things that we almost every day open up and you read some innovation in healthcare. But what's one area that you're like, man, I'd really like to see, a significant move forward?
Yeah, yesterday, Randy's Children's Hospital was innovation session. The combination of genomics and clinical information being brought together to allow for precision-based medicine. I'd love to see more activity around that area because I do believe we can make a difference. I do believe that we can find those cases and be able to provide better care for our customers and our patients. And there's so many opportunities, benefits by doing that. Yesterday I heard some scenarios. They said it took from 6 weeks, they've gotten it down to less than 24 hours. Just think about the efficiency, not only just the care, but the efficiency. That's less amount of bedtime, less amount of visits, the patient satisfaction goes through the roof. We then also have to figure out, okay, when we do that, we'll become more effective. We also have to figure out, well, we're a business, how do we continue to operate, right? So how do we now work with our payers to make sure that we're getting compensated accordingly so that's not taking a hit?
Yeah, so it was the leadership from the Edge presentations were great last night. You had personalization of healthcare, and you had precision medicine as well with Radies. And those were two really good presentations. And then you had the Arch Collaborative presentation with UCSD, which was awesome. Going into next year, what I found? We have a lot of listeners that are in college. They're listening to this going, where's healthcare going? What's it? And so one of the questions I put on here at the end is, what health IT roles do you think you're going to be hiring more of in 2020?
Well, I can reassure you we're going to the way we're going again, moving from the four walls of the institution to outside. We're looking at hiring more CRM-based roles, analytic people that can they're not just looking at data, but they're able to synthesize it and produce results back to the business owner and give them recommendations and not just be a conduit of just, here goes a bunch of data, here you go, do something with it. We're really looking for great analysts. That as well as security experts, that's something that I think we're all going to be continuing to look for. But I do see an evolution there that as AI and machine learning becomes more prevalent, we're going to have our automated, in the future, we're going to have our AI, our machine learning really helping us on the security front. I do believe on the programming front that's going to occur. It's not there now, but it will in the future. So I think if we're really looking for new talent, we need for individuals to help us. How do we help engage using technology, using solutions to help engage our patients in a more consumer-based function, whether it's programming on that front or in essence empowering us to really understand the technologies that are emerging that helps. I think that's something that we should be focusing on as kids. If I had to do it again, I would look at it. That's where I would need to look at it, invest.
If you had to do college over again, would you do something a little different?
Yeah, definitely. definitely. I think consumerism is the key. If we get more people who understand customer service and the customer approach and having the right personality, right advantage, that gives us a huge advantage that we're not necessarily at today.
Absolutely. The intro music's playing, so I don't want to take too much more of your time. I appreciate it. Appreciate you stopping by.
All right, thank you.
I hope you enjoyed the conversation. Remember to check back often, as we are going to drop an episode a day for most of November of 2019. Following that, please come back every Friday for more great interviews with influencers, and don't forget, every Tuesday we take a look at the news which impacts health IT. If you want to support the fastest growing podcast in the health IT space, here's a few ways that you can do that. The first, share it with a peer, share it with a friend, share it with somebody who's working right there next to you. Number two, sign up for Insights and Staff Meeting. These are services designed to help you in your career. Number three, interact with our social media content on Twitter and LinkedIn. Number four, post or repost our content. And number five, always send me feedback, bill@thisweekinhealthit.com. Your insights continue to shape the channel. This show is a production of This Week in Health IT. For more great content, you can check out our website at thisweekhealth.com or our YouTube channel. Special thanks to our sponsors, VMware and Health Lyrics, for choosing to invest in developing the next generation of health leaders. Thanks for listening. That's all for now.